Let's react to another Stephanie video. This one's called Your Fillers Have Failed You.
This is how much lip filler I'm putting in my lips tonight.
Oh no, not the DIY stuff.
So filler causes. This is a brand new study. So what do you do now? If you have filler, do you need to get it removed?
See, like, even now, if you go closer, you can kind of see the migration.
Oh gosh, oh, that's way overdone.
So what you're looking at here is an MRI image. Now the area that is green is the hyaluronic acid filler.
Well, my dears, if you are still stuck in the filler era, listen up, because filler is over. The overinflated, dermally filled explosion that we've seen over the last 10 years has finally come to an end. And thank goodness for that, because some of you gals were looking a bit weird. You heard me, girls. Fillers have failed.
I don't think fillers are gone forever. I think that we've learned how to use them more in moderation, and I think the best injectors are using small quantities and placing it properly so that you don't get these overfilled faces that look like they've just had tons of syringes dumped into their faces. So I think there's a way to still have fillers in the picture, but not overdo it so that you don't get these exaggerated types of faces.
Welcome to the new trend, the anti-filler era.
I am getting my lips dissolved.
I'm going to get my lip filler dissolved.
I'm getting my lip filler dissolved.
I got my lip filler dissolved.
We are dissolving my lips.
I recommend dissolving lips prior to lip lift surgery as well. As you guys know, that's one of the main procedures that I still do. It's a great surgery for a more natural appearance for enhanced lips. And prior to that, I do usually recommend dissolving old lip filler.
Bigger wasn't always better. Once upon a time, small lips were cute. Injecting foreign substances into your face was seen as bizarre, and filler was something you bought to fill cracks in your house. Fast forward to 2015, and Kylie Jenner finally comes clean that her inflated lips weren't actually just down to lip liner or puberty like she had insisted for years, but the result of filler.
And the first HA filler was FDA approved back in 2003. So that was, before Kylie's time. But I do think that Kylie did encourage a lot of people to consider lip filler, and the popularity of that treatment seemed to increase as she started to get lip filler herself.
Google searches for lip fillers increased by 11,300%. Is that a thing? In just 24 hours.
That's crazy.
And for lip filler was off the charts. It was the best thing since sliced bread, and suddenly we all had these juicy, plumped up lips. And considering that this was also the era of makeup YouTube and the beauty guru, who injected just about every square inch of their face available, suddenly having filler injected into your face was seen as normal.
I'm getting lip filler for the first time.
With me to get lip filler.
Today I am getting more lip injection. To get lip filler today, make them a bit more juicy.
And it didn't stop there. We soon realized that not only could you increase the size of your lips with filler, but that we could also create cheekbones from nothing. We could actually make our noses look smaller by making them bigger with filler. We could create jawlines and pointy chins and plump out under eyes. The sky was the limit. Filler was marketed as the non-invasive alternative to plastic surgery, and we were hooked.
And some people falsely think that you can actually try out plastic surgery by using these fillers. Oh, if you want to see what a facelift would look like, well, just inject the face with like 10 syringes of filler. Or if you want to see what a lip lift will look like, well, just try lip filler. But the problem is that it doesn't give you the same type of appearance. We have an older video about using filler for the nose versus an actual rhinoplasty, and you'll see that the results are very, very different on what you can expect and actually get out of those procedures. So it's not good to think of filler as a way of trying out plastic surgery, because the actual results that you get are quite different. And one of the issues I find is that filler sometimes gives plastic surgery a bad rep because people just lump it all together. Filler that's performed poorly also gives people who are performing filler properly, keeping the quantities down, knowing what they're doing, staying safe, it gives them a bad rep as well.
No, you weren't imagining it. Cosmetic clinics and injectors began popping up on every street corner. These people often had no proper training in facial anatomy or formal qualifications.
Yeah, they might have like one doctor who's, supervising the clinic who might be located on the other side of the country. That's not right. So I think think hopefully we're going to see a reduction in those types of just kind of mass-produced sort of med spas that offer these different injectables without proper supervision.
Not to mention their sanitation standards left a lot to be desired, but because they were offering what was otherwise a rather pricey tweakment at cut-cost prices, the customers rolled in. Filler became so popular and so normalized that even children under the age of 18 were sneaking off to get dermal fillers injected into their tiny young faces illegally.
Yeah, people aren't thinking about the risks. You know, there's real risks, and I've talked about it at length on this channel, but these are not benign procedures. I mean, you can have death of some of the skin on your face from filler. You can have blindness that develops from lip filler or any other kind of filler on the face. So you just have to be so careful who you trust with injecting your precious face. You know, this is a big deal. So I hope that people now are starting to feel some of the gravity of these non-surgical aesthetic treatments and weighing them against, first of all, not doing anything, and also against doing potentially surgery instead, which also has risks, but different types of risks sometimes.
MPs have called the non-surgical beauty industry the Wild West, with no mandatory training needed to buy or inject fillers.
I mean, we even had well-meaning mothers taking their beautiful teenage daughters to get fillers in an attempt to rid them of their insecurities.
She's 16. Are you taking her and getting Botox and filler treatments on her?
She had that done, yes.
At 15?
She's felt insecure about how she looks.
Yeah, and sometimes those insecurities are coming down from the parents, right? And I'm guessing that's the case with these folks that are on the Dr. Phil show. And I've seen that play out in my practice as well. Maybe in their minds, well-intentioned mothers, for example, will bring and sometimes fathers too, honestly. I've seen that especially for hair procedures. I've seen those insecurities stemming from the families. And I think they're well-intentioned in that they're hoping that, you know, these are treatments that lead to their kid feeling better about themselves or preventing something that might happen to them later on. But the problem is that they're making the kids worry about something that they really shouldn't be worried about at such a young age. So it can be very problematic, and I think it's up to the provider to step in and say, hey, they're too young for this, and you don't have to do it just because they're willing to pay you for it. And that's unfortunately where a lot of providers go wrong, you know, because they just take money for something someone is willing to pay them for, regardless of what the ask is. And I think that's what separates people who function ethically and morally versus those who just do something to make money.
The normalization of filler became so prevalent and yet so taboo at the same time. We had influencers and celebrities injecting copious amounts of filler into their faces, and yet they would staunchly deny it. Look at Madison Beer, for example. Not only did Madison go on a bizarre rant on her Instagram stories about how she has no filler, thank you very much.
Someone said, just admit you filled your lips. When I was younger, I did when I was younger, and I got them dissolved.
Yeah, so here's what people don't often understand. Just because you get the filler dissolved doesn't mean that the actual visual effect of what the filler was meant to do in the first place changes much. Because I always give this example, but it's kind of like a balloon that if you inflate the balloon, right, with water or air, and then you deflate it or you let the water out, the size of the actual balloon is going to change compared to its original. It's going to be more stretched out. And the same happens to our skin. As you inflate it with this HA filler and you then go ahead and dissolve, it doesn't mean that the appearance returns to its original. So that's why people were maybe calling out Madison Beer on that, but that is something that's often misunderstood.
Madison was so cagey about her tweakments that she literally hid behind a bush in order to avoid being photographed by paparazzi outside the famous cosmetic clinic Epione, which, by the way, is frequented by none other than the Kardashian clan, who, as we all know, are fond of a little or a lot of filler.
And I would say that overall, like, it seems to me like celebrities are more comfortable talking about injectables now compared to plastic surgery. And I think that will eventually change, but at least they're becoming a little bit more open. But other celebrities, like for example, Ariana Grande just recently said that, hey, I had fillers and Botox, but nothing else. And that's where they're still being a little bit, you know, deceitful at times, where they admit to one thing, but then they don't admit to the 15 other things that they may have had. So I think that will change with time as people get more comfortable with some of the things that exist out there and some of the things that folks are doing. But for now, injectables are maybe a little less taboo. Plastic surgery is still a bit more taboo overall.
But Madison isn't the only one who wants people to believe that her beauty is au naturel. Hailey Bieber, for one, gets very offended if you insinuate that she's dabbled with tweakments, as TikTok plastic surgeon Dr. Daniel Barrett realized when he made this video alleging that Hailey had had work done.
In addition to the rhinoplasty, I think she's had a couple other things done, but importantly and very noticeably, lip filler and a genioplasty, which is a chin implant.
And Hailey threatened to sue him.
Last I checked, speculating about surgeries that celebrities have had done is not illegal. It's been going on for many, many decades in many different variations. For the longest time, various magazines have been asking for, doctors' opinions and opinions of others on what a celebrity has had done. And the speculation of that, as far as I understand, is not illegal. It's one thing if the celebrity was your actual patient and you're the doctor and you're spilling the tea about what they had done. That's a HIPAA violation, at least in the United States. But if they're not your patient and you're suggesting that maybe something changed in their face and maybe it was this procedure, maybe it was that procedure, but you don't really know, I don't see how that could be perceived as being illegal.
Hailey, for the most part, does look like a natural beauty in my opinion, and unlike her fellow celeb influencer friends who almost have brand new faces now, Hailey looks remarkably similar now to when she was younger, all except her lips. Yes, Hailey did always have large lips, but she never had an embossed philtrum. You cannot tell me that she doesn't have filler when if you look at her lips, you can literally see the filler migration. See that? There it is.
Yeah, that does not happen naturally. So I think Stephanie has a point. I think it's sort of freeing, I believe, for celebrities if they come out and just say it. Just say what you had done. And people, more or less, I think will leave you alone. It's all this kind of, no, I didn't have anything. And then later on, they somehow admit it anyway at times, or it comes out that they had it done and then it makes them look worse. So, but I think it's, in general, for most people, I think it's more liberating if you're just honest about the work that you've had done. And I think then people have fewer questions and are overall going to be supportive. And it makes the general population feel less bad about themselves because maybe they can't afford certain procedures, but they say, okay, yeah, that explains why maybe said celebrity looks so attractive, as opposed to just feeling bad about themselves and thinking that they're just, not fortunate enough to be born into this beautiful body or to have this ideal face. But most of these ideal faces are in some ways bought and not necessarily something that someone was born with. And I think that is a very important distinction to make for all of society so that we don't have as much of these unrealistic beauty standards or expectations.
Like some people get addicted to things like drugs or alcohol, and some people get addicted to filler.
And then it sort of distorts how you see yourself in the mirror because you start to think that that's the new baseline, that's the new you, and you want to keep maintaining that. But usually when you show someone their photos from many years ago, they're like, oh wait, yeah, that did look more natural. So then they go and they potentially get the filler dissolved. And they're usually quite happy once they get it dissolved.
Women literally began injecting their own faces with filler at home with products they purchased off the black market with no idea what they were doing, risking blindness, necrosis, and infection until something went wrong. We noticed that instead of looking snatched and plump and glowing and youthful, we were looking older. Instead of looking sculpted, our faces were expanding. Our faces were looking fuller, but in the wrong areas that we never injected to begin with.
Remember that HA or hyaluronic acid is like a sponge. It attracts water. That's what it does naturally in our cells, and it does that even with the injected exogenous HA filler. So as it attracts the water, it increases the volume of our face. There's debate whether or not it truly migrates, or is it where you put it but it's acting like a sponge so it's going to grow, but it is increasing the overall volume.
Why did our fillers that we were so loyal to turn on us? How did fillers that were promised to help us fit the beauty standard end up doing the opposite? Here's the thing, I was sold a lie. And so were you. Not only that bigger is always better, bigger lips, bigger chins, bigger cheeks, but we were told that filler is temporary. Filler dissolves. It's basically the same as getting your hair colored or your nails done. It's not permanent. And if you don't like it or it all goes wrong, you can just get it dissolved. No biggie.
Not so easy. It has risks up front and it has staying power. And that's what I think Stephanie is going to get into next.
And for a while, that lie held up. After all, filler is made from hyaluronic acid, and hyaluronic acid is naturally occurring in our bodies, and we were told that over time our bodies would break down the filler, reabsorb it, and it would all be gone. It seemed plausible enough. After all, we'd all had that experience where we got our lips freshly injected and we loved how plump they were. And then a few weeks to a month would pass and our lips deflated. They were back to square one, like we'd never had them injected to begin with. And so we would dutifully head back to our cosmetic injector to get a top-up. These top-ups, we were assured, were necessary to do because, after all, filler is temporary, so top-ups were needed every few months.
How often do I recommend you get your lip filler done? I typically recommend lip filler to be done every 6 to 9 months.
This lie has made the filler industry literally billions of dollars.
Because to make the HA, they have to polymerize it, so it's like they create these like links of HA, and they're much more difficult for the body to actually break down.
Watch me ruin my beauty with filler. This is what I started off at 21 years old. Never did anything to my face. Okay, so now I look like a human blow-up doll. Here is my Simpson lip from the side.
The lip projection becomes very unnatural looking, especially when you look at it from the profile view. And that's actually one of the main reasons why a lot of women who come to me for a lip lift are looking to reverse that appearance. They want to dissolve the lips, bring them into a bit more of a natural state, and then we can elevate the upper lip with a lip lift, and that usually brings a bit more harmony and balance to the face.
I look absolutely insane.
And when it comes to the cheek filler, people are oftentimes putting too much filler into the medial cheek, creating just way too much volume centrally here compared to putting filler into the lateral cheek to recreate more of that heart-shaped face. So that's, again, one of these things that, if you're not going to the right provider, you might be getting too much filler and filler in the wrong places.
Here's the awful truth, guys. Your filler didn't dissolve, it just moved.
Some people argue that it's not so much that they're migrating, but rather they're functioning as a sponge, so you're getting more and more volume over time.
And this is a huge problem. That thick, sludgy filler that we loved in our lips and cheeks and under eyes isn't so good when it collates in our lymph system. If you don't know what your lymph system is, you need to. Your lymphatic system is a fundamental part of your immune system. It is your body's way of flushing toxins and waste out of your system. It is literally your detox system.
Yeah, after surgery, for example, or really after any one of these like non-surgical treatments, you're gonna have swelling, right? Everyone's familiar with the swelling that occurs after a procedure. So the way that that swelling goes away is by draining through the lymphatic system. That's exactly how that works.
Your lymphatic system is one of the main ways that your body fights disease, and if your lymph gets blocked, you're in trouble. If your filler is blocking this delicate lymph system and causing waste and toxins to build up in your body, well, as you can imagine, it's a pretty big problem, and one that the filler industry doesn't want you to know about.
So filler causes cancer. There's a new major study, and it's going to hit people like a ton of bricks. All filler patients will have some degree of blockage.
Keep in mind that there currently is no direct evidence that filler will cause cancer, but there are people who have some concerns. The risk of developing cancer after getting dermal filler is extremely low, if not negligible, from what we know today. The hypothesis that links dermal fillers to cancer is still in its early stages, so I don't think people should really freak out at this time.
The filler was building up and building up and building up and expanding and flattening out and merging together and migrating, and the end result is pillow face.
I've been saying for a really long time that this female obsession with cosmetic procedures shows that we're not in a good place, and finally people are acknowledging something's wrong because women don't really look like human beings anymore, and they're calling it pillow face.
It's interesting how we then go to like opposite extremes, right? Because now with these GLP-1 agonists and people looking to dissolve their filler, now there's going to be this propensity towards looking more gaunt and much thinner, potentially too thin, right? In the sense that the face, if you drop too much volume, you can look a bit sickly, and that could be aging as well.
It's not just older women who have developed pillow face syndrome from too many fillers, it's now happening to the younger generation as well. I mean, have you guys seen Gen X? It's when after years and years and years of filler top-ups, your face just begins to expand. You look older than you actually are.
And we still don't don't know the effects of starting filler so young on your face over many decades, right? That hasn't played out yet. Filler was FDA approved in early 2000s, but it wasn't like super popular back then. So it was only like over the last maybe 5-10 years that people are, doing this more often, and they're starting at younger and younger ages. So like, how will people look, in 20, 30 years after this stuff has had time to, absorb more water and potentially migrate? So that will be something interesting to see, but it's something that we don't have an answer to just yet.
And don't even get me started on the girls whose faces have been virtually destroyed by their filler migrating wherever the heck it wants. You got it injected into your lips, doesn't mean it's gonna stay there. Look at this poor girl who posted this video to TikTok and then deleted it as it went a little viral, and I can see why. First of all, who the hell injected that much filler into her lips?
That's like 1 to 2 syringes per lip. Wow. Too much.
The problem with this girl is that there's no more room in her lips for the filler to go. They are so overfilled. And so the filler is being forced up outside of the lip border and into her filter. No one is going to go to their local cosmetic injector and be like, can you just inject some filler into my moustache area, please? I'm going for the Daffy Duck look.
Well, some people are looking for more definition in their filtral columns, right? They feel like these filtral columns are not defined enough and they're getting filler directly injected into those columns. That's not something I ever recommend because, again, of the migration, but also it's still not a natural look. The way that the filtral columns naturally are, there's maybe a slight bit of elevation, but the reason why it looks more defined in people who have it naturally is because of the central concavity rather than the actual columns being so elevated. The natural version is very difficult to recreate. So instead, people get the filler injected into there, but then they start to develop this kind of almost simian appearance because of the heaviness of the filler in that location.
When your body retains water from eating too much salty food or having poor lymph flow, that water in your body is being drawn to your fillers, which then causes fluid retention in your face. Not ideal. Certainly not what you paid for, not the look you were going for.
Something similar, not exactly like that, but a similar effect occurs with fat transfer to the face, in that the fat has memory of from where it came. So if it came from the belly, as we gain weight, usually we first gain the weight in our midsection, but if you've had a fat transfer to your face, you're actually going to be gaining weight in the face, and the face is going to start to look bigger instead of just happening in the midsection. So that's something else to keep in mind when it comes to fat transfer to the face. But with HA, yes, because it attracts more water, and if you eat more salty food, you're going to increase the water content, exactly as Stephanie said. So that's an effect that you can see because it's HA.
And the worst part about it is that these girls haven't even realized what's going on until it's too late. They get a mill here, a mill there, little top up here, little top up there. Love the results until a few months pass and the effect is gone. The woman assumes that her fillers have dissolved, and so she books into the clinic for a top up. And this is how us girls are slowly ruining our faces over time. This is how we go from looking like this to this. This poor girl is Charlotte Crosby. If you're in the UK, you'll know exactly who Charlotte Crosby is. I mean, she's a pretty big deal. This is what she used to look like. Very pretty. And then she got a nose job and began to inject dermal fillers into her face, which TV presenter Janet Street Porter was not best pleased about. Check out this roasting Charlotte got on national TV.
Why couldn't you have counselling? Why didn't you seek some kind of therapy to live with the face you had?
Yeah, she got roasted there. Yeah, there's always a question of, do we need any cosmetic procedures at all? Or should we all just be going to therapy if we're even considering a cosmetic alteration or a cosmetic tweak? That's a much more difficult question to answer, and there's lots of nuances with that. But I think that properly performed cosmetic procedures in moderation and performed tastefully and safely can have a huge impact on how somebody looks and feels, instead of sending them to therapy where they might be put on antidepressants and other medications, and where just talking to them about their emotions might not be enough to change the course of their life and how they feel about themselves. Sometimes a slight tweak might be healthier than being on medications for the rest of your life. There's a lot of nuances to that, and it's really a case-by-case basis. And surely some people do get addicted to plastic surgery or to these non-surgical procedures, and that's something that we need to understand and accept that is out there. And also we have, of course, body dysmorphic disorder, which is very real and affects some percentage of people who are seeking out these treatments.
Charlotte is a shining example of someone whose filler initially looked brilliant, And then over time, her fillers began to fail. As you can see, over the years, Charlotte's filler began to build up and expand and migrate until she almost looked like a totally different person. Luckily, Charlotte realized that she'd gone a little overboard with the fillers, and her fillers weren't serving her anymore, and she had her lips dissolved.
And even with the dissolved state of her lips, they're still not like the original, right? As we were talking before, they expand with like that balloon effect that I mentioned, and they don't return to the exact original state almost ever, especially if you've been doing this stuff for years.
The new trend is having your filler dissolved. Filler is out. Pillow face isn't it. And the new old money, minimal, clean girl aesthetic is in. If you want to talk about overdoing the lip filler, you needn't look further than Faye. Faye's lips are overfilled to the extreme. And big lips, whilst on women who have them naturally look utterly beautiful, they didn't fit Faye. Now, Faye realized that she'd taken it a little bit too far and had her lip fillers, you guessed it, dissolved. Unfortunately for Faye, because she had had so much lip filler injected into her naturally petite lips over the course of 7 years, when she had her lip filler dissolved, she was left with lips, as she describes them, looking like ball sacks, with skin so stretched and wrinkly that they would likely never recover.
And sometimes we end up doing a lip reduction to try to address some of that stretched out skin that has occurred at the red or pink portion of the lip. And that's yet a different procedure from a lip lift. And sometimes we end up doing both because people are looking for more volume, but they don't like how stretched out that skin is of the actual lip. And then we're also doing a lift with an incision at the base of the nose to roll the lip out and to give it some natural appearance of volume.
Just like the old balloon, your lip skin is going to sag. It's been so stretched that when you dissolve the filler that's been holding it up, there's nothing there to fill it out, and it just droops.
Well, it droops, but it also like expands out, right? So that's why in the lip sometimes you can have what looks like almost like nodules, but it's just stretched out skin from the prior filler. And so it's not that it's just sagging, but it's also just stretching out.
Yes, it's true that if your fillers go wrong, or you get too much, or you just don't like the look of them, you can have them dissolved. Enter hyaluronidase. Hyaluronidase is an enzyme that degrades hyaluronic acid, which is what fillers are made out of. So it makes sense that hyaluronidase can dissolve filler. But think about it. We also have naturally occurring hyaluronic acid in our bodies. And believe it or not, guys, it can actually get even worse than this. Some women claim that their faces have been left permanently destroyed by hyaluronidase.
Skin hanging from the bones. It's all loose.
Yeah, it's partly the work of the hyaluronidase, especially if it's used at high concentrations like I mentioned earlier, but it's also the fact that the skin was stretched out with the filler and now you've removed that filler and you have saggier skin that's more expanded. It's both those elements, I believe. But now more young people are going to be getting facelifts to try to reposition that tissue, and that also brings into question lots of other potential problems, such as increased surgical risks if you've had a facelift in your younger years and now you're getting one every 5 to 10 years thereafter to keep up with the initial result, right? So as you keep going back in for more and more surgery, your risk of bleeding goes up, your risk of nerve injury goes up. It just becomes more difficult to navigate deeper in the facial planes.
And it's so sad. I mean, our love of fillers started off so positively. It was like this healthy, new, budding relationship, and everything was exciting, wholesome, and mutually beneficial. And then the relationship turned toxic. Hear me when I say that too much of a good thing is not a good thing. Now, in conclusion, if you have had filler in the past, currently get filler, or were thinking about starting to get filler, and this video has left you shocked and disturbed, good. That's what I wanted. Not necessarily to scare you and stop you from getting filler. I mean, it's your own face. You can do whatever you want with it. But I just want you guys to know what you're dealing with.
I definitely think it's great that Stephanie voiced some of these concerns that people should have and are continuing to have about facial fillers. I think that to balance the conversation, it's important to keep in mind that it's still possible to have fillers done tastefully by a good provider who cares about how you will look over time and is not looking to just, load your face up with tons and tons of this material. And even Hylenex can be administered more safely by lowering the concentrations that are being used. So like most things, there has to be a balance, and there's usually some sweet spot somewhere in the middle. Right now, the pendulum is swinging heavily away from fillers, but I'm sure we're going to start to equilibrate to some form of stable ground in the middle where people can still achieve their aesthetic goals, but do so safely without causing major problems for themselves later in life.